It's been 3 years since the Phoenix VA was at the center of a national crisis. Incredible wait times putting veterans in danger. That's why we are taking action this morning, talking to the new director of the Phoenix VA. Dan joins us now from the newsroom. Good morning, Dan.
Yeah, Justin, it's Memorial Day, so a lot of people like to make the designation. It's not Veterans Day. We focus on those who gave their lives, the ultimate sacrifice for our country. But of course, we also tie in the veterans who are living, still fighting that fight, trying to get the care that they deserve. RimaAnn Nelson, director of the Phoenix VA, joining us. Thank you so much.
Thank you, Dan.
It's early. Good to have you in studio with us.
Thank you for having me here.
Let me ask you this question. First of all, on days like Memorial Day, like Veterans Day, do you have a personal connection to someone in your life that you've thought of, that you think that person just kind of embodies that spirit of service for our country? What does it mean to you personally?
Well, I do have a friend whose father had passed away in Vietnam when he was a little boy. And every year I call him and his family and tell them how grateful we are, grateful I am personally for the service that his father gave for our country. He himself served as in Iraq and Afghanistan as well.
A lot of people thinking about their loved ones and friends today. Let's talk about the VA system here in Phoenix, because as you know, you kind of inherited what was a firestorm of scandal. Sadly, it's associated now with Phoenix VA. When people on the national scale, international scale hear Phoenix VA, they think of the scandal. Talk to us about the current state of the Phoenix VA system. Have we gotten better?
Yeah. So our healthcare system today is definitely not what it was in the past. And we have continued to make great strides in improving and coming up with innovative ways to find and to deliver care to our veterans in a timely manner. So we are definitely committed to that. We have opened 2 new clinics here in the Phoenix area. We have doubled the size of our emergency rooms, and we are continuing to look at the use of teletechnologies to deliver care for our veterans. And right now we are using telebehavioral health to make sure that we provide mental health to veterans in the rural areas. So there's just some examples of things that we are working on, but we still have a lot of work to do.
You answered that question in part. Now I wanted to bring in Richard LaBerge, a viewer this morning. I asked on my Facebook page, what would you like to ask the director? And that was his question. How are we better monitoring the wait times and delivering the care? So it's just advanced technologies, I imagine, as you said. How do you win back the confidence, though? Because there's the court of public opinion oftentimes that they associate Phoenix with the rough wait times. And as recently as January, there were reports where our senators Flake and McCain both said these are some still disturbing trends, things that haven't been resolved yet. When you talk to the veterans out there, how do you reassure them that things really are getting better?
Yeah. So gaining back the trust of our veterans is also a priority for us, and for all the veterans that come through our door every day for care. It's going to take every veteran to believe that we are able to deliver on that care. So we again do that by several things. I not only tell veterans but also our employees, you know, I can't fix what I don't know, and when things are not right, let us know and we will address it and deal with it in a timely manner. But the other thing is really looking at those wait times and looking at the number of consults that we get every day on a daily basis so that we can stay ahead of the growth at the Phoenix VA. You know, we're very happy that many of our veterans are choosing to enroll and receive their care at the VA. We have over 91,000 veterans now, which is a lot more than it was 3 years ago. We had over 1 million outpatient clinic visits last year alone. So the growth is there. Veterans are telling us they want to receive their care at the VA, and we have to continue to earn their trust back and focus on access and wait times. And the great thing about that we have here in the Phoenix area is that we have great community partners, and when we're not able to deliver that care in a timely manner, we can reach out through the Choice program and let the veteran choose where they want to receive their care. All
right, I know that is the top priority, to make sure that these veterans get their care. On this Memorial Day, we're thinking a lot about those vets and their families. Director Nelson, we thank you for coming in this morning. Thank you for giving some answers there to our viewers. Justin.
Thank you.
All right, thanks, Dan. So